Good morning students, my name is Sreema Jeevan. I am dealing community health nursing, unit number 4, epidemiology and the nursing management of common communicable diseases. So last class we have studied about the zoonosis and under that one, so there are so many types of zoonotic diseases are there. So we'll see it one by one. The first one as per your syllabus is viral zoonosis. So under that one, certain examples, that is rabies, yellow fever, Japanese encephalitis and forest diseases. So these are the topics which is given in your syllabus. So we'll go according to the topics. The first one under the viral zoonosis. So in the name itself it is there. So zoonotic, that is it's a viral infection caused from the animals to the human beings. So it is a viral zoonotic diseases and all. So first one is the rabies. We'll see the detail about the what is rabies, how it is causing and all. So rabies, the introduction. Rabies is a viral diseases that causes the inflammation of the brain in the human and other mammals. So rabies, actually it is a viral diseases only. It is caused, it will be causing the inflammation towards the brain in the humans and other mammals. So we'll see what is the incubation periods. So the incubation of the rabies is typically 2 to 3 months, but it can be vary from 1 week to 1 year. So how it is vary from 1 week to 1 year? So it is depending towards the location of the virus entry. So depending upon the entry of the virus, so the incubation period will be varying from 1 week to 1 year. Okay, so that's the main point in the incubation period. According to the location of the entry of virus, the incubation period will be vary from 1 week to 1 year also. So third one is causative organism. So rabies virus belongs to the family of Rabboviridae. So it's a genus Lysellus virus and a stereotype. Okay, stereotype 1 only. So it is a rabies virus only, which is the main causative organism for the rabies. So it is a family of the Rabboviridae family only. Then we'll see the mode of transmission. So rabies exposure will be occurring usually through the bite a human or another infected animals. Okay, so usually, so how it is causing means it is transmitted through the saliva, touching an open wound or touching the mucous membrane. Okay, so how the rabies virus is exposed means because of maybe biting from a animal to the that is infected animal towards the human. So the transmission usually it will be through the saliva only. So if there is any wound is there, the infected saliva is contact towards the open wound, or it will be touched towards the mucous membrane and all, means it can leading towards the transmission as the virus is entered towards the particular body. So like that only the mode of transmission. So we'll see the next how the stages of mode of transmission. So actually I have told you mode of transmission by a biting of an infected animal to the human. So what happened, we'll see here. So in the picture you can able to see the man is standing and the dog is biting the particular man. So here first point, virus enters into the tissues from the saliva of the biting animals. So what happened here means entry of virus through the bite. So once they are biting, the open wound is there. Through the open wound the virus is moving inside. Okay, second point, replication in the muscles. So what is the second point? The virus will be replicate into the muscles where the nearby area of biting. Okay, then what happened next means third step is virus moves a peripheral nervous system to the central nervous system in spinal cord. So with the help of through the spinal cord, what happens is this virus will be moving towards the central nervous system, and it will be binding, this virus will be binding towards the receptors on the postsynaptic membrane at neuromuscular junctions. So this virus will be moving from the particular biting area towards the central nervous system, and it will be biting the receptors on the synaptic membrane, postsynaptic membrane in the neuromuscular junction. Then once it is entered towards the central nervous system, virus ascends spinal cords. So here what happens is transportation of the virus is there. So, and while they are going for transportation, they will go for the spreading of infection towards the particular areas where it travels. Okay, then so it is moving towards the central nervous system through the spinal cord. So this virus will be reaches towards the brain and causes the fatal encephalitis. So once it is reaches the entry of entry of virus into the central nervous system, which can be leading towards the fatal encephalitis. Infection towards the central nervous system, brain, it becomes as encephalitis. So once the brain is infected, the virus enters towards the salivary gland and other organs of victim. So the fatal condition will be there towards the person who got a biting from an infected animals. So what happened here is full failure of sensory as well as the autonomic nervous systems, and because of spreading of infection, so brain is damaged, so full of infection, and it is going for the damaging. Okay, so these are the stages. Then we'll see the clinical features. So under that one, early symptoms and the late symptoms are there. Early, what happened is so we can able see some images there. So fever will be there, cough, sore throat. So these three things, three symptoms will be coming in the early stage of rabies. So who is affected, and late stage if they are showing as restlessness, hallucination, seizure, and coma will be there. Okay, so these are the early late symptoms. It is exhibited by the patient, that is restlessness will be there, hallucination, seizure, and the coma. So we'll see here the signs and symptoms, that is two category, that is early stage and the late stage. That is once more I am repeating. So early stage means the fever, cough, sore throat will be there, and in the late stage the restlessness, hallucination, seizure, coma will be there. And we'll see some of the features, that is prodromal features. In that case the person will be having the fever, malaise, weakness, that is headache, vomiting, anxiety, agitation, and pain will be there. Okay, so where the site of exposure, so there the patient will be getting the pain will be there. So these are the features will be coming under the prodromal features. So their main and so which can leading to, I have told you, so virus once it is reaches to the central nervous system, which can leading towards the inflammation to the brain. So we'll call that one as encephalitic rabies condition. So 80% of the people will be getting the encephalitic rabies condition. So here the person will be showing the symptoms of fever, confusion, hallucination, combativeness, then seizure, autonomic dysfunctions, then because hypersalivation and all will be there, and then cardiac arrhythmias and all, hydrophobia, aerophobia. So then late complications, so maybe they will be getting the late complications such as cardiac failure, respiratory failure, and multiple organ failure. Okay, so the mainly, so once the virus reaches towards the brain, it will be getting the infection, we'll be calling it as a encephalitic rabies. So 80% condition will be there for this occurrence. So fever, confusion, hallucination, so combativeness, seizure, autonomic dysfunctions like hypersalivation will be there, goose flesh will be there, cardiac arrhythmia, priapism and all will be there. And hydrophobia, aerophobia. So phobia means fear only, water, air fear will be there. And some people will be having the late complications like cardiac failure, respiratory failure, and multi-organ failures. And so we'll see what is hydrophobia. Involuntary painful contraction of the diaphragm, accessory respiratory laryngeal muscles in response to swallowing the fluid. Okay, so here they will be having the phobia towards the water, that is fear to water. Why it is there means involuntary painful contraction of the diaphragm which leading towards, that is dysfunction will be there. For inspiratory neuron, that is which is near towards the neurus ambiguous, resulting towards a defense reflex, and it will be protecting the respiratory tract. Okay, so in that condition, pathogenic rabies, or in the absence of any of the animals and all, they will be feeling of involuntary painful contraction of diaphragm and all. Because of that one only they will be having the fear towards the water. So we are calling that one as hydrophobia. The next one is aerophobia. The same features will be there for the person. So it is aerophobia means it's a fear towards the air. So what happened here means they will be having same involuntary painful contraction will be there. It is inspiration. During the inspiration they feel more contraction of the diaphragm, which can leading towards the aerophobia conditions. And presence of some typical encephalitis with the relative preservation. Some person will be having consciousness. Okay, so episode of hyper excitability followed by the complete diseases progresses interval between the short period, them in a short time. Okay, so then progress rapidly and common followed within a day by death is rule unless the course prolonged by the supportive measures. Okay, so here what happened here means rapid progression in the diseases will be there, which can leading towards the person to go for the coma stage within the few days, maybe by death also will be there within the particular timing. Okay, so difficulty to recognize the late complications. So I has told you before the late complications and all. So they will be having the clinical causes when the progression to the coma was occurred. So once the coma stage is there means you can't able to recover towards the patient to the normal stages and all. So here it is very difficulty also to recognize the late complications such as the cardiac failure, respiratory failure, and multi-organ failures and all. So that's about the encephalite, 80% of cases. So remaining 20% it is causing the paralytic rabies. So here paralytic indicating that the weakness of the muscles only. So here in the early and prominent facet muscle weakness will be there. So in the especially in the bited area, who maybe as quadriplegia will be there, or the facial weakness will be there, and which can able to spread for the paralytic rabies condition. So here maybe having the sphincter muscles and all will be having the involuntary movement. Commonly it is an involuntary movement only. So in this time and all, sometime it become as loosen towards the sphincter muscles. So unexpectedly the person will be passing the stools, motions and all in the paralytic stage. Okay, so sensory involuntary mild. Okay, so sensory perceptions also will be getting as involuntary only normally, but it is very mild in nature in case of paralytic rabies. So lacks of cardiac features, that is hyper excitability will be there, then hydrophobia, then aerophobias. So mainly when you are telling for a phases like that, incubation period of the particular condition is 20 to 90 days. So that is maybe, as I has told you, up to the 3 months. Maybe the duration will be changing according to the location of the entry of the virus and all. And here the second point is prodrome. Then prodrome cases 2 to 10 days, that is fever will be there, malaise, anorexia, nausea, vomiting, paresthesia, pain and pruritus at the particular wound site and all. And acute neurologic diseases is there. So it has already has told you, that is 80% of encephalitic rabies and 20% of paralytic rabies. Okay, so in some so once they are in this stage, go through the encephalite rabies and paralytic rabies, they will go towards the coma stage and will leading towards the death of the particular patient. Then we'll see the investigations. So cerebrospinal fluid analysis will do, because the person is having the encephalitic conditions. Then MRI of the brain, because the person is having encephalitis and paralytic conditions, and it will be affected towards the neuromuscular junctions and all. So we'll see the where it is affected mostly, and we will see under the with the help of the MRI brain report. Okay, EEG, we will see the function of the brain, whether it is a good condition or not. Okay, then we'll see next one is treatment. So treatment, actually it is a no establishment of the treatment. So we'll go for once the rabies is there means we'll go for isolate in a quiet room as bright light, noise, cold, draft, perspiration, spasms or the convulsions. So we'll mainly making the room as a quiet room only, and we'll put the person in a isolation room. Okay. Then third point, sedatives. To relieve the anxiety, we are giving the sedation and hydration, proper dehydration we are giving. Then intensive respiratory and cardiac support, because I have told you, maybe as a late complication the person will be getting the cardiac failure, respiratory failure and other mild other organ failure also is there. Then we'll see about the preventions. In the prevention, the health personnel should wear the facial mask. As we the nurse or the doctors, they will be have to go for wearing once you are contacting towards the rabies patient. So we are going towards the particular patient. So we should protect yourself. Okay, so for that one, health personnel, we should wear the face mask, then gloves, goggles and apron. So because we want to prevent from the infected person, that is if any wound in the particular area in our body, so if they are their saliva is touching or keep in contact with the open wound, means we also will be getting the infections. Okay, so apron and all we will be wearing mask, gloves, goggles and aprons. Okay, in order to prevent from the contaminated, that is infected body to the normal body. Okay, so then next point is persons having bruises. The person will be having the bruises and it will be cut or open wounds. Do not entrusted to look after the patients. So the person will be having the bruises conditions and all, and we'll see about the cut or open wounded not entrusted towards the patient after the conditions. Okay, so they'll see the next point is pre-exposure prophylaxis and post-exposure prophylaxis. Here in this case we'll see the first one, post-exposure prophylaxis. Here we are giving the treatment of antibiotics because the person is having the infection. We'll go for giving the priorly we are giving the antibiotic treatments. Secondly, active immunization by the rabies vaccination. Then passive immunization by the human rabies immunoglobulin, we can able to go for giving towards the post exposure of the prophylaxis conditions and all. Then we'll see here the pre-exposure prophylaxis. So in the, that is before the exposure, what will be the prophylaxis, we'll see. So for the people with the occupational maybe or in the recreational risk of the rabies, which is including the travelers to the rabies endemic area having primary schedule consisting of 3 doses will be there. So if you are going for exposure towards the endemic area, so what you will go for taking is 3 doses. We are taking 0, 7, the 0th day, 7th day, 21st day or to 28th day. After 1 month, if the virus neutralizes the titer, that is less than 0.5 international unit per ml. So dosage, it is a booster dosage only we will be taking, that is the first month. And further at the interval of 2 years as long as expose the person at risk. So pre means if you want to work in an endemic area which is having the rabies condition, and all means before itself you will be taking the vaccination, that is booster doses, and will take. Once you taken the doses, we can able to go for the maybe as 2 years if you are exposing in the particular location itself. So post means after, that is after the exposure we'll go for taking the antibiotic treatments, then active as well as the passive immunization will be taking. Then we'll see what is rabies vaccination. So the vaccination will be taking, that is rabies. To prevent the rabies, we'll take the rabies vaccination. So it is we can able to use in the intramuscular regimen case, and the intradermal schedule also is there. So intramuscular regimen, it is a standard WHO intramuscular regimen only, so SN schedule only. So what here they are doing is 1 ml dosage given in the IM, deltoid muscle only we are giving the IM. Then children anterior, so in the case of the children is anterior lateral aspect of the thigh we can able to give the rabies vaccination, that is IM only we can give. That is only 1 dose 1 ml doses only we are giving towards the IM. Okay, so the adult and we are taking deltoid, and for the children we are taking an anterior lateral aspect of the thigh. Okay, 5 doses of vaccination should be given on the day, that is 0 dose, then 0, 3, 7, 14 and 28. Okay, so these are the 5 doses which is given for the intramuscular regimen, so as per the WHO. Second one is intradermal schedule, that is 0, 3, 7, 28 and 90th. So 2-site intradermal vaccination has been used in India, that is endorsed by the WHO only. The expert committee on the rabies, they has formulated this one, the 2-site intradermal vaccination, that is 0.2 ml doses given at each 2 site on the day, that is 0, 3, 7 and 1 site on the 28th and 90th. So intradermal dose is actually the 1/5 of the intramuscular dose. So it is dosage is 1/5 of the intramuscular dosage only, that is intradermal schedule and all. So there are 2 divisions are there, 2 sites are there for the intradermal vaccination as per the WHO expert committee on the rabies. One is 0.2 ml dosage which is given to the 2 site on dates 0, 3 and 7, and on site on the day is 28 and 90. So 1/5 of intramuscular dosage only it is. So that's about the rabies. So rabies is the viral diseases only, so viral zoonosis only. So it is caused by the biting of the infected animal. So what happened here means mainly this picture you can able to learn here. That is a virus which is entered towards the body through the saliva once it is biting. So what happened here means replication of the muscles in the nearby bited area. So through that one it will be entered towards the body and it will reaches towards the central nervous system via spinal cord. So once it reaches to the central nervous system, it will start for the infections and all. So will be causing the encephalitis condition. So we'll call as there as a encephalitic rabies. So once more infection and spreading of infection is there means which can leading towards the more problems. Okay, so more failures will be there. That is for example cardiac, cardiorespiratory and multiple major organ failures and all. So which can sometime it will be leading towards the paralytic rabies also. So in the clinical features, early and late is the fever, cough, sore throat is the early, and lately restlessness, hallucination, seizure and coma. So there are so many features are there, prodromal features. So in that one encephalitis rabies will be there. As told you, paralytic rabies, encephalitis rabies, that is 80% cases, and the paralytic rabies will be 20%. So investigation which we have seen is cerebrospinal fluid analysis we are doing firstly so because of for checking the inflammation, then MRI brain and EEG for the function of the brain. And here the treatment is actually it is a not established treatment only. Usually will give for the isolation of the patient and will keep all the things ready for the supportive therapies and all. Then prevention. So as we the nurses, that is a health person, we should, once we are approaching towards the patient, we should wear the mask, face mask, gloves, goggles, then aprons, okay, to prevent us from the infected person's fluid, body fluid handle. We are using this personal health protective equipments, personal protective equipments and all. Then next there will be having the exposure prophylaxis, that is post and pre-exposure prophylaxis will be there. So pre means before the exposure. So before the exposure we will take the vaccination. So there are 3 doses are there. So 0, 7 and 21 or the 28 day. So you can say first one we will be taking as a booster dosage will be given here. So if you are working in the endemic area and all, we will be taking the pre-exposure prophylaxis treatment. Okay, post means after the exposure we will be taking, because the infection inflammation, because of that one will give the patient is antibiotic therapy and all. Then active and passive immunization also we can able to give. Then we have seen about the rabies vaccination. So we are giving the 2 routes, that is intramuscular regimen and intradermal schedule. So in the intramuscular, WHO has told about the 5 doses of vaccination, that is 0, 3, 7, 14 and 28. And intradermal schedule, WHO expert committee on the rabies has told us a 2 site of intradermal vaccination, that is 0, 3, 7 and 28 and 90. So it is a 1/5 of the intramuscular dosage only. Okay, so hope you has understood about the rabies. It's a long topic only, so you can able to learn the topic with the help of this screen recording classes. If you having any doubt means you can able to ask me. Thank you.